know the milliliters to ounce. There are 454 grams in a pound. That's kind of important. There are 2.2 pounds per kilogram. That's probably the one you'll use the most, is 2.2 pounds per kilo when you're converting pounds and ounces to kilos. So this brings us to dosage calculation methods. Those of you, let me ask the class this. How many of you have administered medications to someone other than yourself?
You mean just like at home or in a hospital?
Anywhere. Many of you, okay. How many of you have administered medications to someone other than yourself by a different route than oral? A few injections, IVs. Okay, all right, good. So a little bit of experience with fluid and medication administration. How many of you have experience administering these medications in a healthcare setting versus a home? Okay, good. That's good. So, kind of see which classmates have some experience doing those things. It can be a resource to you. Because there's nothing like actually getting your hands on some of this equipment and doing it to really understand a little bit how it operates. You, through the course of your own education and background, have learned different kinds of methods for problem solving for an unknown. I am not here to tell you to change your method of calculation. If you have a dosage calculation method that works for you, is tried and true, gets you the right answer every time, and you like it. Don't worry, if it works for you, use it. If, however, you don't have such a pattern or a pathway, what we adopt here at College of Marin is the dimensional analysis method, because we have discovered through just sort of our own review of the published literature on the best way to introduce calculations to students, and on the ability for us to help support students with getting more and more sophisticated with harder and harder calculations. This seems to be the method that works the best, is the most straightforward. It's not one that's for everybody. I didn't learn this in nursing school. I taught myself when I became a teacher, and I fell in love with it because it's so versatile. It's a little bit of a long panned method, or long method sometimes, but what's so nice about it is that it's so reliable. Because if you follow the journey, you're always going to get to the right destination. And so I appreciate it for that. So if you're having a pizza party, for example, and you want to know how many pizzas you should order for your party, and you don't know how many to order, but you know all these other things, how many people you're having, how many slices per person they'll eat, roughly estimated, and how many slices each pizza has, you can take what you know to get to what you want to know. And the same is true with dimensional analysis for medication calculation. And this is especially useful when you have multiple factors and multiple conversions that you have got to enter into your equation. You can do a bunch of separate calculations and still get there, but by doing one, you'll be more assured that the factors you want at the end of your equation in your solution are actually the ones that you have calculated by the way you set up your equation. The ratio proportion method, which takes a look at how you can make two sides of an equation equal one another, is very useful if you have simple calculations. And so, if you have something simple like there's 100 milligrams in a tablet and 50 milligrams was prescribed, you can set it up like this as a simple ratio and proportion. Ratio meaning a fraction or a relationship between one expression and another, and proportion means that there's an equality on both sides of the equation. You can simply set this up and make this be x, because you don't know yet how many capsules to give, and solve for x by cross-multiplying and dividing. But you can also use the dimensional analysis method for something as simple as this. Same thing with parenteral drugs. If we're giving a volume and there's a certain amount of drug per unit volume, and you've got a prescribed amount of drug, and you need to know how much volume to give, you can set it up like this. Or when you get fancier and you've got dimensional analysis level needs where you need to figure out how many drops per minute to give, meaning you need to look at the drip chamber in your IV tubing and count how many drops should come out of that every minute to deliver your dose in a given amount of time, half an hour, whatever's been ordered. You're gonna need a little bit more to get the drops per minute from the information that you have on hand. And that's the dimensional analysis pathway. We will be able to work through these things together, and as you practice with these, it'll get more and more comfortable for you. You can use a ratio proportion method with this kind of a problem, but as you can see, it gets convoluted and complex. It can be multi-step, it's easier to lead to errors. This is that same problem you just saw in the last slide set up in a dimensional analysis format. And you can see how easy it is when what you're working with is dimensions more than numbers. You can see that to get to drops per minute, you need to keep drops in your equation, and it needs to be on the same side of the fraction as the drops that you need in your answer. And you need to get rid of the things you don't want, and you do need to know the minutes. Another factor that's in your answer, hours is not in your answer, milliliters is not in your answer, hours is not in your answer. And if you enter the information this way, then once it's set up properly, you know that the only answer you can come up with will lead you to the factors that you want with the right numbers attached to them. Question?
And that's something that you'll show us and give us hands-on examples of.
I will today. You were walking before you run a little bit in that you haven't been doing any dimensional analysis in your current book so far. You don't get introduced to it until probably another week or two. But we're gonna probably start talking about it today, because it's not too early to start talking about this, because we can use it for simple things. Okay. Let's talk about some special populations. Children. Children are special, we know that. And they're especially special when it comes to considerations around medication administration. Vulnerable populations like children, like elders, like medically fragile individuals, like pregnant women, they have some unique needs that make us need to be ever more vigilant about not only the risk for making med errors, the need to avoid making med errors, which accrue to every patient, but also the sequelae that happen when errors occur can be more devastating in special population areas. And we have some physiologic changes that happen in certain populations that make the window of tolerance for medication errors much narrower. So children, because of their small size, have relatively immature organs that don't work the same as adult organs. And because they're not as developed, they absorb, distribute, metabolize, and excrete drugs differently than adults, not as effectively. We then are giving smaller doses to pediatric patients, obviously, than we are giving to adult patients, because small people need smaller amounts of medication to achieve the same effect therapeutically. And that means that the margin of safety for medication use and medication error is very small. And the smaller the person, all the way down to a preemie neonate, the smaller that margin of error becomes. Neonatal medication administration is a very high-risk adventure, and nurses that work in the NICU double-check every single medication they administer to their patients with another nurse. It's just part of their culture, and it makes good sense. Pediatric doses because the children are growing quickly, need to be a little bit flexible, and the dosages often need to be altered in a rapidly growing little person. So we often are basing our pediatric dosage calculations on weight or on other clinical parameters like body surface area. So weight-based dosages are most common when we need to calculate in a baby who's in a NICU growing. Let's say they put on a pound. Well, the dosage of medication that they are going to be getting from the time that order was originally given until they are a pound bigger is going to change. And so we are going to have to change our calculation for how we translate that into what we administer. And body surface area, this is the equation for body surface area. There's a number of tools that will calculate body surface area for you. And so you don't necessarily need to remember or memorize this. But BSA, it comes into play with both pediatric and with burn patients. When we're calculating fluid replacement volumes, we often use body surface areas to calculate how much fluid in milliliters per hour we want to give our patient. So you may see dosages written in milligrams per kilogram over a unit of time, or micrograms per kilogram per unit of time, and that takes into account those varying weights. This is a summary of the current 3 or 4 chapters that you did. This is largely review. Let's talk a little bit about rounding, because rounding is going to be important as you're expressing, not only as you're expressing your answers on a test, but as you're making calculations so that when you turn around to do something with a syringe, that you know that you're getting as precise a dose as you can. Because sometimes, especially with very small doses and very small volumes, a change in just 1/10 of a milliliter actually changes the dosage you're giving to someone, right? If you give even 1/10 of an ml more, and there's so many milligrams per ml, you've all of a sudden changed the order if you add an ml by rounding up. So the rounding rules are just the general rounding rules that exist in mathematics. If you get an answer to your calculation that ends in something that is fractionally less than 5, you're going to round down to that whole number. If it's 5 or greater, you're going to round up to the next whole number. If you are asked to solve something for the closest whole number. So, drops, for example. Let's say that there are so many milligrams of drug per drop of ophthalmic solution, eye drops. And the provider perversely orders some milligrams. That means that you have to give 4.2 drops of eye drops. Can you give 4.2 of eye drops? Mm-hmm. No, you cannot give 4.2. So you would round that to what?
4.
You would round it to 4, that's right. And then you would call the provider and go, by the way, I'm not giving X number of milligrams of eye medication. I'm giving X number of milligrams less because I can't give a fraction of a drop. A fraction of a drop is just a smaller drop, and I can't do much with that. So for medications that really, they have to be rounded to a whole number. Can you think of some other medications that have to be rounded to the next whole unit, or the one whole unit down?
Would it be like extended release?
Yes, extended release, things that can't be split, crushed, divided. So extended release tablets, capsules that have the little beads inside. You can break open the capsule and all the little beads are inside. You can't like deal out those beads to give a half of one of those. What else? IV flow rates can be titrated to the 100th place with our smart pumps. And so we'll talk about the need to not round in those cases.
I guess it's just the both said so.
Yes, you should be getting instructions for testing purposes about how many places you should round to. But in those areas where you have to round to a whole number, you have to think about before I give this answer in 2 decimal places, is this a drug I can give to 2 decimal places? Suppositories. You can't really chop those in half. I mean, you can chop those in half, but the way that the drug is distributed through the suppository may not be equal. So that when you cut it in half, you can't be sure that there's the same amount of drug in one half of the suppository as in the other suppository. Anything else? Yeah.
About for like a capsule medication.
Yeah, if it's a capsule that is not a time release or it's not, well, let's talk about that. In general, oral pills that can't be easily divided because they're either not scored, and scored means it has almost like a cut started into one side of the pill. If it's not scored or not easily divided into half, then you would want to clarify the order to get a whole number ordered. There is an OB, and I come from an OB background. I'm a perinatal nurse, so it's all the OB things you're going to be hearing. Sorry, but I know it, I love it, I do it. There is a medication that's given in maternity units to help ripen the cervix in preparation for induction of labor. It's not FDA approved for that purpose, and we'll be talking about off-label uses, but this drug, to give the dose that's ordered for this purpose in this patient, it needs to be divided in quarters. The tablet itself is tiny. It's tiny as the tiny yellow tablet that's going around the classroom.
Are you talking about misoprostol?
I am talking about misoprostol. Or Cytotec is the brand name. It is very, very difficult to divide that in half, let alone in quarters. And so even though we know we're probably not giving exactly a quarter of that dose, we're getting as close as we can using a pill splitter. But those are examples about dividing doses of medication that do require that you do the calculations necessary so that you can get as close to the dosing you can, and then look at the preparation you have in your hand and go, can I give a third of a transdermal patch? I don't know. Not if the medication is not distributed evenly across that transdermal patch. Okay, so that's rounding rules. If you're rounding to the 10th place, you follow the same rules. Go and you look at the hundredths digit and you go, okay, well, if the hundredths digit, meaning the second decimal place over, is 5 or greater, I'm going to round the 10th place up to the next 10th. If it's less than 5, I'm going to round it down to the lower 10th. That's some of what you were doing in your exercises in Curran this week, right? Is everybody comfortable with rounding? Great. All right, I review the metric system and radiation percentages. We didn't talk a lot about concentrations of medications, but percentages of strength of your medication are important to take note of. Percentages are calculated by the number of grams per 100 mLs of solution. That's considered your percentage of strength. And the greater the percentage, obviously the stronger the drug is. Okay, these are a lot of just, I'm going through these quickly because what we have is a lot of nomenclature here that we've talked about. Good. This is rounding, leading and trailing zeros. Please don't forget your decimal point. Let's do some practice. So let's start by taking a look at the syringe that this nurse is holding. Can you tell by looking at it what the total volume this syringe holds?
1 ml.
1 ml? 1 ml. So what we're looking at with 1 ml then is that every one of these larger solid black lines represents 1/10 of a milliliter, right? sub-sublines in here, right, represents a tenth of a milliliter, right? And so you can, if you were thinking about, I need to draw up 0.25 of a milliliter, you would be able to do it easily on a syringe like this, would you not? If you had a 3 milliliter syringe and you were asked to draw up 0.25 of a milliliter, you'd have a harder time. So in the next week or so, I'm going to be bringing in syringes of different sizes so that you can kind of play with and see how they look, how you would draw up medications of different volume amounts, and the idea of selecting the right size syringe for the right ordered dose or volume. Okay. Let's do this one. Solve this one, and you're going to express it in the nearest whole number. And let me know what you get.
Handy dandy calculator.
So you said 36, right? Does everybody agree with 36? Would anybody say 37? At 36.458? Yeah, 3333. So if we were just looking at 36.4, we would know that we would round that to 36, right? But now we've got this other difficult information. We have 36.458. So if we were looking at all of these digits, we would actually be rounding the 5 in the hundreds place to a 6, wouldn't we? If we were answering the question in hundreds. And if we rounded it to 6, we would round the 10th place to 5, wouldn't we? And if we rounded the 10th place to 5, we would round the whole number to 37, wouldn't we? Now, this is a case of too much information has created a conundrum. But the most right answer with the information we're given is probably 37. Because this number, as it's expressed to us, is closer to 37 than it is to 36. However, I do think your book, because it tells you to only look at the tenths place when you're rounding, is to take that tenths place and make your determination based on where you would round that tenths place. And because it's a 4, you would round to this number to 36. Have I confused you? No. Have I made you think about what you might do in clinical judgment? Yeah.
How about, how will you grade us?
Yeah. Well, I am going to ask you in test to round to the hundredths place. And the reason I'm going to ask you to round to hundredths place is because most IV smart pumps will allow you to enter volumes to the hundredths place. And so that gives you the most information. Unless you have a problem that you have to round to a whole number for. Like I'm asking you how many drops per minute. If you give me a fractional drop that's rounded to the hundredths place, you'll be wrong. Because you can't give a partial drop, right? But I'll remind you of that before the test. Okay. And in this case, if I was mean enough to give you a question that ended in a thousandth place or a 10,000th place that caused you to have to keep rounding and rounding and rounding backwards, then I would probably accept either answer and give you a gold star. Question?
My question is what rule do you want to use? Like if we wanted to the hundredths, are we only using the thousands or are we using rounding?
If you're rounding it to the hundredths, you have to look at the thousandth place.
But do you want to look beyond?
It's in the question. Like it says round to the nearest whole number. So
This one is round to the nearest whole number. Your question is about when I'm testing. And I'm asking for you to round to the two places.
Okay.
Look at the next, I would say the rule is to look at the next place.
Okay.
Look at the thousandths place. Because it's following what the book is teaching. Okay. Round each number to the nearest tenth. So 6.76 becomes 6.8. 22.04 becomes
22.
not become 22.0.
Oh, you don't put the 22. zero.
Oh, yes, good, 22. See? 15.715, we're going to the hundredths place here. Becomes
15.7.
15.72. And 1.444 becomes
1.4.
1.14 by Jove. All right, let's express this one to the nearest tenth. Now you're working with all fractions. What'd you come up with? 0.4. 0.4 is correct. Now, when you're working with fractions like this, remember that the 0.3 is a numerator, right? It's a whole number. So in your mind, if you want to do this, and it's not a bad idea to do this as we're approaching dimensional, you can put 0.3 over 1, just to make everything a fraction, and keep your mind kind of focused on the top numbers stay on the top and the bottom numbers stay on the bottom. Yes?
I thought, I mean, I think maybe I'm remembering it wrong, but I thought the book had some kind of distinction with if you had multiple decimals, then they wanted a specific rounding versus if they were whole numbers. But now I'm not sure where I saw that.
I'm not sure I'm following your question, but the essence of this is that you're going to get direction in a testing environment. You're going to get direction in NCLEX and by me about how many decimal points to take your answer out to. Does that help? Okay, which one of these in number 1 is written correctly? Right, B
B.
is, because there's no leading 0 in A. How about number 2? B is correct. Number 3. Good, because you don't need this trailing 0. And number 4? Good. Okay, you got that concept down. Converting metric measures. So when we go from a larger to a smaller unit of measures, and you'll agree that micrograms are smaller than milligrams, there's a way that you can do the math to enter a conversion factor and divide it all out. Or you can take your little pencil and you can start playing move the decimal. When you're going from a larger to a smaller unit of measure in the metric system, you're going to move the decimal place 3 spaces to the right. And when you're going from a smaller to a larger, assuming we're in increments of 1,000, you're going to go 3 spaces to the left. So these first 2 are going from a larger to smaller, so we're going to move the decimal 3 spaces to the right. How many micrograms is 30 milligrams? 30,000. How many milliliters is 4 liters? 4,000. 4 big full IV bags of a liter each are 4,000 milliliters. Now we're going to go from smaller to larger. Now we're going to go in the other direction. How many liters is 660 milliliters?
0.66.
Okay, right, you don't put the trailing 0. Okay, and what about 420 micrograms? How many milligrams is that? 0.42. Great. Quick. All right. Let's look at a couple of dimensional analysis questions, okay? We're advanced, we're moving ahead. And for this, I am going to take us a little bit forward. To, I think this may be actually. So we're in chapter 9, which is your intro to dimensional. And let's go to page 121, where you have an intramuscular injection that is ordered for your patient. And the intramuscular injection dosage that's ordered is 250 milligrams. 121. 120, 121. 121.
Huh?
Good?
Yeah, but mine just says a different, mine says 275.
Really? Oh, I'm sorry. It is 275.
Page
It's me
two-
at 5 o'clock.
275?
No, the page is
Okay.
121.
I'm like, what?
The dosage is 275.
Okay, I'm like, Okay. what?
You want to see?
Mine's on this page.
All right. The intramuscular dosage ordered is 275 milligrams. And the drug that's available, you have a vial that you're going to pull your dosage out of, is 0.5 grams in 2 milliliters. How many milliliters must you give? So this is very typical about pulling fractional dosages from a larger vial that has more volume and more dose than you need, and we have to do a metric conversion, right? So let's do this. I'm trying to figure the easiest way here. Again, we're always going to start with the end in mind. What do we want to know?
How many milliliters?
We want to know how many mLs that we want to use a syringe to pull out of that vial to get the dose that's been ordered. Okay? How many milliliters? We only want to know milliliters. So let's start by keeping milliliters as it is in the numerator on this side and on this side. You see, I start with the end in mind. I'm starting here with the answer that I want to discover, because I know that by knowing where I want to go, I'm already going to be honest about what I put over here. So what do I have available to me that has milliliters in it? How many milliliters? 2 milliliters has how many grams? 0.5 milligrams? 0.5 grams. Okay? Now, I don't have grams in the ordered dose, do I?
Mm-mm.
275 milligrams is what's ordered. So I don't want grams in my answer. So I need to do something that gets grams out of this equation. And I need something that's eventually going to get milligrams out of the equation too, because it's not in the answer, but I have to deal with it because it's the ordered dose. Okay? So what's my conversion factor, the conversion expression that tells me how many milligrams in a gram? And you guys intelligently put grams on top because that would cross cancel grams. Now all we need to do is get milligrams out of here by what's ordered. And we put that opposite this. That's going to tell you how many milliliters you need to draw up. How many milliliters is it? 1 point. 1 point. Now, if there's a half a gram, which by the way is 500 milligrams, and 2 milliliters, in our brains we know, well, in 1 milliliter, there's going to be 500 or 250, so we're going to need a little more than 1. That's a way of mentally checking if you're on the came up with 1,000 ml. And you look at this logically, you go, oh, that can't be right. So this is perfect. That's dimensional analysis, you just did it. You just did it. So if I give you some complex formula where you have to convert ounces to milliliters and baby's weight from pounds and ounces to kilograms and dosages or breast milk volumes in ounces and milliliters, you could put all of those expressions in here as long as you know where you want to go to begin with. You're always going to be able to get there using this journey, using this pathway in this process, okay? Things are going to get more complex as we move into conversations about IV fluids, about pressor agents that are titrated over time, about induction agents where we're giving oxytocin 1 billion units per minute and we want to increase it incrementally over time to get a certain clinical response. Those things are all managed using this process. How does it feel? Does it feel good over there? Let's do one more on that board and then we're going to be done.
I'm assuming we are.
Okay, almost Liberty weekend. We're gonna go complex.
Mm-hmm.
We are now on page 167, and we are going to do why would we ever need a count drops per minute when we have these smart infusion pumps that will deliver milliliters
Yep.
per hour?
Can you speak up a little bit?
Sorry.
Sorry.
I kind of thought I'd give this side of the room equal. Why would we ever want to give drops per minute or calculated drops per minute answer when we have smart infusion pumps that will deliver milliliters per hour? Technology fails. All of the electrical systems go down and all the ventilators are plugged into the emergency generator outlets and you have, as the nurse, to calculate your drip rate by hand, manually. You can't calculate milliliters per hour by hand. You can calculate drops per minute by hand. So you're going to be counting how many drops come out of that drip chamber in your IV tubing every minute. And what we need to know is how fast does the healthcare provider want it to run, and what is our conversion rate for the drip chamber. Drip chambers come in different sizes. Remember we talked about 60 drops can't equal a teaspoon if you have a tiny or a gigantic turkey-based dropper. It's the same thing with IV tubes. They come in standard drip factors that range from 10 drops per milliliter to 60 drops per milliliter. So you have to know, what is my drip chamber dripping at, right? How many drops make up a milliliter in volume? So that's a conversion factor. So let's take a look at this particular question. Calculate the drop per minute rate to infuse 2,500 milliliters in 24 hours using a 15 drop per milliliter infusion set. It's given you every piece of information you need. What do we want to find? We want to find drops per minute. So let's start with what we know about our drip factor or our drip conversion factor. How many drops per milliliter will our drip chamber, our IV set deliver? 15 drops per ml. 2,500 milliliters in what period of time? In 24 hours. Well, now we have a new factor, a new dimension, hours. But hours, it isn't in our answer. It
1 hour over
minutes
60.
in the answer. So we have another conversion opportunity, right? So we do. Okay. An hour on the top, because that does that, 60 minutes on the bottom. Because 60 minutes matches the minutes we need down here. So milliliters are gone, hours are gone, we have drops per minute. Isn't that much? How much is it? 46. 26 drops per minute. So, that's doable for an